kids being born today, being born now, that when their generation comes up, they're going to be called the COVID gen.
Oh, that's
Or the Corona gen, maybe, something like
I
that.
like Corona gen.
The Corona gen.
It sounds like it fits. I don't understand the youth, so anyone born after like 2000.
You don't understand the youth.
Yeah. You just, I just like TikTok. I don't get it. I tried. I don't like it.
But there are people who get famous on it.
I know, for not doing anything.
Did you see the kid who did the Thanksgiving musical?
No.
So this kid who sings on TikTok, and James Corden saw him do something. He's famous for singing in supermarkets, like in the middle of the aisles or something, doing TikTok videos. Anyway, they had him do a song about Thanksgiving, sitting at a table, but then he added a lot of Broadway stars doing other aspects of it, and so it became this whole big musical thing. It was really funny. Like Patti LuPone was the grandmother, the drunk grandmother.
That's talent. That's I'm okay with. The kids, then they're just like.
Yeah.
I do that in my room.
You do?
Sometimes when I dance.
What are you doing here?
Hey.
That's good dish.
One of my ears in my car.
I'll be sure to be Facebooking about that too. Because that's what my generation does. We do the Facebook.
Yeah.
Oh gosh.
Yeah, you will.
The
Already.
vaccine.
I don't do Instagram.
Again,
I don't even do
I
Twitter.
see you talking about
I
this.
don't
I sent out the
you get a lot of news,
Yeah, I
She's
think
a
so.
fire.
Yeah.
I mean, the things
So I'm
that
doing
we
combo, that's gonna be,
Yeah.
she's my topper.
We did that a long
Yeah.
time
But
ago.
you don't even read it, like other people's?
Oh, I'll read other people's, but
I
I
haven't even-
personally don't read. It's only because it gets really annoying, so I have to like, I'll be like, log in and see more, like, say I want to go further with someone.
And that's, the advisory panel.
I do have Instagram, but I cleaned it up.
Oh, yeah.
Just like from college, just,
I think the 10th is still though.
care about.
FDA.
Yeah.
It's quite wild.
Woo, yeah. Oh my god.
I have a couple of those videos. I delete them.
So, Jim Haggerty always asks a question.
He's like one of the first ones, but he hasn't asked a question.
Are there a lot coming in?
Not a lot, they're only like 8, but like it worries me, like is it working?
Started falling apart on me.
Yeah.
Hey, Eric, are you friends with Jim Haggerty?
Am I?
Yeah, or do you like know him?
Personally.
You say no?
Not personally. he said.
Oh,
Craig me.
Haggerty? I don't know the name.
Rock River Times.
oh, maybe.
I interpret
Yeah,
from report.
yeah.
I interpret from reporter to English.
Wait, is the mayor having something today?
I'm sorry.
Or is the mayor having an announcement right now?
I don't know about the mayor.
He just usually after
The last thing I knew about was Cook County's tree lighting last night.
Wait, a tree.
Cook County did. Preckwinkle had a tree lighting. A virtual tree lighting.
I did, yeah.
A different interpreter, Diana Thorpe. You may meet her, actually. She's going to start doing press conferences.
So, when it pipes up, what do you do?
I don't know.
Well, good afternoon, everyone, and welcome to the COVID-19 update for Tuesday, December the 1st. To start, I want to affirm that my administration is monitoring the situation at the 11 Illinois long-term care facilities owned by Infinity Healthcare to ensure that services for our most vulnerable residents continues uninterrupted. There are hundreds of SEIU nursing home workers on strike who are asking for the same type of reasonable working conditions that a large number of long-term care facilities around Illinois have already agreed to in their own contracts. And given the significant federal and state financial support for nursing homes during this pandemic, it's important that workers see that funding reflected in their that they see that funding reflected in their workplace, in their safety and their pay. It's very important to me that the owner and the unions are able to sit down and negotiate quickly and in good faith so that they can get back to work and to the work that matters the most, which is getting our residents safely through this pandemic. So on to our regular COVID update. Just as has been the case throughout this pandemic, the new COVID-19 diagnoses of today were a result of actions people took days, even a week or more ago. The new COVID hospitalizations of today were people who were first exposed 1 or 2 or sometimes even 3 weeks ago. And those who passed away due to COVID-19 today may have been fighting in the hospital for days or weeks or possibly even longer. All that is to say that we know that we aren't going to see the bulk of the impact from Thanksgiving in our data quite yet. Just as it took time to see the impact of the 4th of July and Labor Day celebrations in the data. Additionally, past experience has taught us that decisions about whether to get tested are much different around the holidays. As expected, we saw peak demand here in Illinois running up to Thanksgiving, followed up by a significant drop-off. As you could imagine, that leads to more uncertainty in the trends that we're seeing in this in-between period. Today's uptick in our positivity rate could be from exposures beginning perhaps 2 weeks ago and including exposures that may have occurred at Thanksgiving, or it could be attributable to these fluctuations in testing. Yet another reason that we need to give ourselves time to monitor changes as behaviors begin to normalize. Again, people returned now from Thanksgiving. What I am certain of is that this virus is circulating widely in every county across the state of Illinois. And if you are exposed to the virus and become infected, you will be infectious before you're aware that you have this disease. That means if you didn't socially distance at Thanksgiving and you spent time with people who are not in your own family bubble, you may feel fine right now, but you could nevertheless be passing COVID-19 on to others without knowing it. So for anyone who traveled or gathered with family and friends for the Thanksgiving holiday, monitor yourself for symptoms. And if you have any of those symptoms, stay home. Even if you think you are having allergies or experiencing what feels like a mild cold, IDPH recommends that you stay home as much as possible and avoid close contact with other people, and that includes those in your own household. If you didn't travel for the holiday, now is not the time to go have an in-person visit with your friend who did. For those who traveled for Thanksgiving, IDPH recommends that you get tested between 5 and 7 days after your return. So that's tomorrow, Thursday, or Friday. That's only if you're asymptomatic and you want to go get a test. If you have symptoms, you should get tested right away. This is the time to be extra careful. With a surge of the virus expected, limit your mobility outside your home and stay home if you don't feel well. Even if you feel well, other than leaving for work or for school or for essential trips like going to the grocery store, these next few weeks are a time to stay home as much as possible. Assume you were exposed, and assume more of your coworkers or friends were exposed than ever before, and act like it with social distancing, wearing your mask whenever you're in public, whenever you're with other people. It's the safest thing that you can do for the people that you love and for the healthcare workers who risk their lives to help you when you need them. When Dr. Ezike stands up and provides these updates each day, you'll often hear her add, these are more than numbers. She's right. She says these are people, mothers, fathers, siblings, children, friends. COVID-19 has stolen so many lives that weren't ready to be taken. That's the curse of this disease. And it's a curse made incredibly more painful when it rains down upon so many families all at once. Our next speaker knows that pain all too well. Mrs. Shauna Seegers of Stager, Illinois, her husband Otis, and their son were 3 of the thousands of Illinoisans to become infected with COVID-19 last spring. Shauna and her son recovered, but tragically, Otis did not, and he succumbed to the virus in April. I asked Shauna to join us today and to share her story with all of you. She graciously agreed to speak to you in hopes of preventing someone else's tragedy. So with that, I'd like to turn it over to Shauna.
Hi. Thank you, Governor Pritzker. Can you hear me?
We can.
Awesome. Thank you for inviting me to join today's share my family story with you guys. My name is Shauna Seegers, and I am a lifelong Illinoisan. In March of this year, my family and my husband, we were affected by the COVID-19 virus. It started with my son and my husband, both truck drivers. I don't know exactly how we contracted it. I just know that we did get it. One of the things that back in the early part of the COVID illness, we began to feel ill, and a couple of days later, I began to feel ill as well. Okay, at the same time, we think that my son was sick as well. We went to the U of I and we got tested, and they confirmed that my husband and myself had the illness. We actually began quarantining ourselves prior to being diagnosed. However, after the diagnosis, we began being vigilant about changing the sheets, making sure no one entered our house, making sure that we did not go any place. My brother and my sister, they began to go shopping for us. They began to drop things off at the door, food outside the door, and they would do the ding-dong ditch and run and go back to the car. One of the things that we were able to do is that we were able to quarantine ourselves so no one else got it, but both Otis and I was having a hard time. Otis a little bit more difficult than I did, and we went back to the hospital. That particular day, which was March 28th, they told me I could go home, but my husband had to stay. That was the last time I saw him alive. They began to give him oxygen, but it wasn't enough. On March 30th, they told us that they had to intubate him, and his oxygen level was dropping lower and lower. Otis never recovered, and on April 25th, Otis passed away. Since that time, every day has been a challenge, focusing on new memories and how to live without our loved ones in this ongoing difficult time, especially during the holidays as it gets closer to this time of year. It's going to be difficult for my family. It's going to be difficult for my children. I do want to say that I don't want any other family to experience losing the pain that my family experienced. So please, please, please follow the guidance of Governor Pritzker and the IDPH. Stay at home as much as possible. Wear your mask, wash your hands, and please try not to hang with people that you don't know. As a matter of fact, don't hang with people that you don't know. This COVID-19 virus is impacting people's lives. I'm partnering with friends and family so that we can make sure that it doesn't affect people like it affected us. And around this time of year, people are struggling from the virus. Anyone that's struggling financially and they experience a loss from the virus, we want to actually help them out. On December 11th, we're going to be at the Creek Park District accepting donations because we want to be an assistance to families, accepting non-perishable food, toys, and accepting donations via check. If you're able to drop that donation off, we'll be there from 5 p.m. to 9 p.m. And since today is Giving Tuesday, I would like to encourage everyone to think of a way to give back to your community if you are able. And everyone can support their community. Remember to do this: mask up, wash up, and back up. Thank you, Governor Pritzker, and it's back to you.
Thank you very much, Shauna, and thank you very much for sharing your story and of course, your great loss of your great love, Otis. And you and I spoke about the fact that your son, thank God, recovered. And I know you have other children too, and they so far have been free of the virus. But I think your messaging, your standing up and telling people your story is very, very important, so that people know that they really need to follow the mitigations, that this can be tragic when it gets into a home, when it gets spread among a family, and there's so much that people can do to prevent it, and hearing your story helps teach that to them. So thank you for your willingness to share. And now I'd like to turn it over to Dr. Ezike for today's medical update.
Good afternoon, and thank you, Ms. Shauna, for sharing your story. Happy December. Let me start with the numbers on this first day of December. In the last 24 hours, over 116,000 tests have been reported for a total of 10.6 million COVID-19 tests performed here in the state of Illinois. 12,542 new Illinoisans have been diagnosed with COVID-19 since yesterday, for a total of 738,846 total cases in Illinois. We learned over the last 24 hours of 125 additional lives lost, for a total of 12,403 deaths. Overnight, 5,835 people were reported to be in the hospital with COVID-19. Of those, 1,195 patients were in the ICU, and 721 patients were on ventilators. Some of the questions I frequently get are, what's causing these cases to increase? Or what can prevent hospitals and healthcare workers from being overwhelmed? Well, that's a great question, and the answer to all of those questions is our human behavior. We're seeing cases increase because although so many people are wearing masks and being compliant, there are still many that aren't. So many people made difficult choices to forego Thanksgiving in a traditional way and observe virtual Thanksgivings in the hopes of preventing an ICU Christmas, but many did not. Many people are staying home as much as possible, but others are not. And these actions of moving about and mixing up households do allow the virus to spread more quickly, which means there's more opportunity for more cases. The chances that hospitals and healthcare workers will be overwhelmed could actually be reduced if people would take these actions and be responsible for maintaining them. The state has implemented mitigation measures, and they're in place to help protect people and to limit the transmission of the virus. IDPH has provided guidance to long-term care facilities, to hospitals, to schools, to funeral homes. We've shared information with medical providers, superintendents at schools, and we've tried to directly educate the public on how to reduce spread, and we'll continue to do so. And as this holiday season continues, I ask you what you are going to do. I heard Ms. Shauna remind us that it's Giving Tuesday. You can give the gift of life by taking on some of these simple measures that are not so burdensome. We told you at the outset of this journey, at the beginning of COVID, as we started with the phases, that we would be close to our normal when we got to, quote, phase 5. And that phase 5 was when we had vaccines that were readily available and many people had been vaccinated. Well, we're close. And so we need us all to hang in there for this final stretch. It means that we still have to continue avoiding gatherings. It means that we still have to wear our mask. And don't forget, we have to wear it over our mouth and our nose every time. And we still have to maintain 6 feet of distance. We've been battling this pandemic together since January. And we will continue the fight, but it will take all of us. We can't go to every house to see if people have invited others over from other households. We can't check every business to see if everyone is complying with wearing the mask over both their nose and mouth. But if you choose to dine indoors rather than take it out and pick it up and take it for home, you're not helping the situation. What we can do is ask you to reevaluate your behaviors, take personal responsibility, wear your mask, avoid the gatherings, continue washing your hands. Let's do everything we can because lives are actually at stake. And even if you're not going to get ill, which I don't know how anyone could know that with certainty, but we want to protect those who are very vulnerable and who need our support to get them to phase 5 when we're in a vaccine world, when in a world with a cure, where the dangers won't be as they are at present. The governor is always going to continue this battle. IDPH and I will continue our battle, this race against COVID-19, but we will get to the finish line sooner if we're all working together. Thank you. Hola y buenas tardes a todos. En las últimas 24 horas, más de 116 pruebas de COVID-19 fueron hechas para un total de más de 10.6 millones de pruebas aquí en Illinois. Desde ayer se han reportado 12.542 nuevos casos de COVID-19 para un total de más de 738,000 casos solo aquí en Illinois. También hay 125 vidas perdidas en las últimas 24 horas para un total de más de 12.400 muertes en Illinois. 5.835 personas pasaron la noche en el hospital con COVID-19. De ellos, 1.195 pacientes estaban en la unidad de cuidados intensivos y 721 pacientes estaban en ventiladores. Algunas de las palabras de las preguntas que recibo con frecuencia son: ¿qué está causando el aumento de casos? ¿Y qué puede prevenir a los hospitales y a los trabajadores de salud a no sentirse abrumados? La respuesta a todas estas preguntas es simplemente nuestro comportamiento. Estamos viendo un aumento de casos porque la gente no usa máscaras todo el tiempo. Las personas se reúnen con familiares y amigos que no viven en su casa y la gente no se queda en casa cuando pueden. Todas estas acciones permiten que el virus se propague más rápidamente y es por eso hay más casos. Las posibilidades de que los hospitales y los trabajadores de salud se vean abrumados pueden reducirse si las personas simplemente tomen la responsabilidad de sus acciones. El Estado ha implementado medidas de mitigación para ayudar a proteger a las personas y limitar la transmisión del virus. IDPH ha brindado recursos a centros de atención a largo plazo, a médicos, hospitales y escuelas, educación al público sobre cómo reducir la propagación, y continuaremos haciéndolo. A medida que continúan los días festivos, les preguntó: ¿qué van a hacer ustedes para ayudar nuestro esfuerzo? ¿Vas a evitar las reuniones? ¿Vas a usar tu máscara cubriendo su nariz y boca cada vez que estés con otras personas? ¿Vas a mantener 6 pies de distancia? IDPH ha estado luchando contra esta pandemia desde antes que se confirmó el primer caso en Illinois. Y vamos a seguir luchando, pero no podemos hacerlo solos. No podemos ir a todas las casas para ver si han invitado a gente. No podemos revisar todos los negocios para asegurarnos de que todas las personas usen una máscara. Lo que podemos hacer es pedirle que tomen responsabilidad de sus comportamientos y sepa que al no usar una máscara, al no evitar las reuniones y al no lavarse las manos, estén poniendo en riesgo la vida de los demás y su mismo. El Estado continuará su batalla contra el COVID-19, pero solo ganaremos si todos estamos del mismo lado. Sí se puede. Muchísimas gracias. And with that, I'll turn it over to Governor Pritzker.
Thank you. Before I take questions, I want to weigh in on something that's happening in Washington, D.C. in the U.S. Senate right now, and that's debate over a stimulus package, discussion among senators. I want to urge the Congress to step up and include in the stimulus package support for restaurants and bars that have been so hard hit by the virus. Millions of Americans have lost their jobs because certain businesses, through no fault of their own, had to shut down or severely downsize because this virus can spread more easily in those settings than in others. If we want to rescue millions of jobs and entrepreneurs and help them get through the next 6 months as we go about distributing the vaccines, the Congress must include the Restaurants Act in the stimulus package. States like Illinois are doing what we can to support small businesses with our business interruption grants. But restaurants and bars will have a tough time making it through this winter surge of the virus without federal support. Finally, today, in honor of World AIDS Day, I ask us all to take a moment to remember and honor the fight to end the HIV epidemic. And this year's global theme of delivering quality, people-centric HIV prevention and treatment services also speaks to the importance of building affordable, accessible healthcare systems that sustain the well-being of our communities, pandemic or not. That goal wouldn't be possible without many nonprofits and community organizations on the ground reaching people, providing access to preventative medication, educational materials, as well as meaningful services and support for those living with HIV. Of course, the same could be said for just about any field of work. Time and again, it's the local organizers and nonprofits who dedicate their days to building trust and supporting their communities through harm and through hardship. So in honor of Giving Tuesday, I want to ask all of us who are able to find a way to learn about and support a local community charity, especially those that support basic needs for families in Illinois. Go online to find the website for your local food pantry or your local homeless shelter or your favorite local organization and see what ways they're looking for support this holiday season. Many more Illinoisans are in need this year. And honestly, even a small act of kindness can save a family. And with that, I'm happy to take questions from members of the media. Yes, Craig.
Governor, the CDC's advisory panel meeting this afternoon. When do you anticipate getting final guidance from the CDC so you can finalize the state's plans for rolling out the vaccine?
What do we anticipate getting from them?
When do you anticipate you will get that so that you can finalize state plans?
Our hope is that they'll be finalizing their work and distributing it to the states in the coming days. Obviously, as soon as they are able to deliver that, we'll be able to take that into consideration in the way that we prioritize how the vaccines will be distributed across Illinois. But let me remind you that the vaccines that are on their way, potentially, if the EUA is approved by the FDA, are potentially coming in the middle of December. And those vaccines, because of the limited numbers of them, will go almost all to healthcare workers, and if there are enough, then next to those in long-term care facilities, the staff and the residents. But our anticipation at the moment is the numbers are small enough so that it won't go beyond those two populations and may not even get to all healthcare workers, at least not in that very first shipment that we receive.
Do you have an update on just how many doses the state is anticipating?
I'm glad you asked the question about the update, because truly we get information every day, new numbers. They change every day from the CDC and from the FDA about how many doses will be available. Right now, it looks like, and this is as of today, and tomorrow it could change. Right now, we've been told so far that there may be 109,000 doses, which is about 54,500 people, because there are 2 doses per person. So that's the very first shipment. That's not all that we'll ever receive. That's just what they are telling us today we would receive when the first shipments are made. I am hoping that we'll get more. I'm hoping that number doesn't change, but we're at the whim of the FDA and the CDC and the federal government as far as those first shipments.
Yeah, it's my understanding, just from reading the website, that the same sort of distribution infrastructure that's used for the flu vaccine every year for child immunizations is going to come into play here. Is that accurate? Is that enough? Is that robust enough?
Well, it'll be slightly different, if I may say, because these vaccines that are coming in December and in January have not been approved for children. They're only approved for adults. So there are trials going on, and that will go on over the next couple of months with regard to children and the impact of these vaccines on children, the dosage that's right for them, and so on. But this first shipment anyway, and these first several shipments really are aimed at adults.
Follow up just on the vaccine, if I could, Governor. Dr. already said today that she does not anticipate Chicago will have any kind of mandates for vaccinations. Where does the state stand on potential mandates, and if there are any, who might be part of that?
Yeah, there aren't any mandates in place. It's certainly something that you know, as you know, always is under discussion. What I know is that we're going to be focusing on those populations that are most vulnerable, and also the people who treat the most vulnerable, not just healthcare workers, but others who may work with the most vulnerable. And so, you know, essential, we've sometimes called them essential workers. We want to make sure that they're vaccinated as well. But there are not currently any mandates, but we will look at what the history of vaccinations has been, and what populations you might require vaccination within, and evaluate that in the context of these new vaccinations that are coming in.
We'll do one more in the room, and then we got to get online.
Obviously, healthcare workers are prioritized. Will the vaccine go to counties based on population, or based on virus burden, or all of the above?
I think I want to turn that over to Dr. Ezike, because she is steeped in it every single day, and I only get a report every other third day.
So there are many considerations. Of course, you know, everyone has heard about healthcare workers being at the front of the line. There are so many people that are high priorities, and you know, we have many of my team members are on the call right now with the Advisory Committee on Immunization Practice, the ACIP meeting, which was it's going on right now. It's a 3-hour meeting, so we'll get a lot of information in terms of if they're going to recommend some different prioritizations. What they had established as the groups in August, there may be some reorganization. Again, understanding that we don't get to the end point until almost everybody is vaccinated. So it's just a matter of, it's not whether you're in the 1A or the 1B, or if there's a 1C or a 2, everyone needs to get vaccinated. But understanding some of the trends that we've seen already in terms of who has had the worst run with it, whether it's the certain communities, whether it's certain ethnic populations, whether it's certain age groups, whether it's certain people with certain medical conditions, trying to figure out how to put that in. I don't even think it means that, you know, this person is more important than this person, but just understanding and appreciating that there are certain really high-risk groups that we need to focus on giving it first. And just getting those high-risk individuals, people who are involved with the public all the time, who work in the ICU doing procedures that can cause the virus to spread in the air, or the person cleaning the room of the COVID patient. All of these are high-risk people, people who make sure that there are foods on the shelves in the grocery stores and are in contact with lots of people. All of those are high-risk people. So just understanding that, everybody needs to get the vaccine. There are a lot of people who are essential or critical to making sure that life can continue. And so there will be a lot of information that will be ascertained from the meeting today. We will continue to put that into the plan, but we absolutely will look at areas, regions that have had large number of deaths per capita. We already know that African Americans are most likely to die. So weighing all that in, of course, there's never going to be a perfect equation to make that, perfect. I don't think there is a right answer, but we are very intentional and looking at all of these issues. And again, this is not a one and done that we get that first allocation, hopefully, if everything goes well, sometime in December, and then we go. We're going to have months of trying to get this vaccine out, and we will continue to adjust. We'll be following the data and the metrics to see who has been immunized, who has not, which parts of our senior population have been immunized, and then we will it's a supply and demand thing, right? So we don't have enough for everyone to get it. So we will just be adjusting the distribution and the allocations to try to get as many of those high-risk people up front, but knowing that the goal is to get it to everyone and hoping that there is going to be the will of the people to actually receive it. That's another important part of this.
Dr. Ziegate, this question from John O'Connor is for you. Isn't it misleading to say we are close to getting past this? Close is 6 weeks, and do you really expect 70% of people to be vaccinated before late spring at the earliest? We have quite a slog ahead of us, don't we?
I don't know who decides what close is. I know I have a kid that will be going to high school next year, and she's like, I'm soon going to be going to high school, and we know how many months that is away. So that's all relative. But I think given how many months we've been at this, and now we're, I think, in the 10th month, I think thinking that we are at the point that we talked about from month one, that we hope to have a vaccine, and thinking that we are in the month where we might actually have that vaccine, that should be seen as a significant milestone, getting us closer to the end. So yes, it will take time to get the population of Illinois vaccinated. This is not a 1 or 2 month process, that's true, but I am looking for something to hold on to and give people hope. And I want to remind people, while we're getting everybody vaccinated, we still can control this virus even as people are getting vaccinated, by wearing our mask and not transmitting the virus in the circles that we're already in. So there's a lot of work to be done by everyone. I am hopeful, and I think we should be looking at the glasses half full rather than half empty.
Jamie Monks at the Tribune. Do you attribute the large jump in new daily cases today from the past several days to a testing lag over the holiday weekend, or is something else driving that change?
Well, let's start with, you certainly can look at the testing numbers and say a lot more people got tested. I think almost twice as many people got tested, maybe it was 80% more over the last 24 hours than did in the, over the weekend. So I think you certainly have to take that into account. When you look at the positivity rate on a one-day basis, not a good way to look at these numbers, but I just wanted to point it out. It's 10.8%. Just on a one-day basis, and that's higher than the 10.2 or 3 that we've been at on a 7-day average. But just pointing out that huge upsurge that you're talking about, right, going from about 6,700, I recall, on Sunday to the numbers from Monday that were reported now at 12,000 and some. That I think you can say that there's probably a mixture there of doing a lot more testing to uncover cases and people coming back and maybe having some symptoms.
Kelly Bauer from Block Club. How long can we expect to be under Tier 3 mitigations, and how long will we wait to see if there's a post-Thanksgiving surge?
I wish I could answer the question exactly how long. What I believe, what we are following here is that it takes really 1 to 2 incubation periods to really understand what the effect of a holiday is or the effect of some event is. And so if you count the number of days, that could be 28 days at the outside from Thanksgiving. We'll see. I mean, we will begin to see the effect here 5 to 7 to 10 days from Thanksgiving, and that's coming up just in the next few days. We will start to see whether there's an effect from Thanksgiving and whether that effect, if there is an uptick, continues on an upward trend. I mean, that is what the doctors that we talked about yesterday, Dr. Fauci, Dr. Birx, and the experts here in Illinois, Dr. Murphy, Dr. Landon, and others have told me is that we should expect to see the surge upon a surge. But I'm also praying that the work that we've done, keeping people in Tier 3, having Tier 2 and Tier 1 just before it, that might mitigate the damage, let's say, that the Thanksgiving travel may have done to the numbers.
Dave Dahl at WTAX, LaSalle, Quincy, compare and contrast.
Well, first of all, we follow the law with regard to reporting to families. 24 hours is the time period now for reporting to families if their loved one in a veterans home has been infected or has a disease. We've issued 2 reports already. Think back to that incident at the Quincy Veterans Home. It took an awful long time to get information out. We have 2 reports that have been issued, one that came from IDPH, one that came from the Department of Veterans Affairs together with the federal VA. And then, we've also instigated and initiated the DHS Inspector General to do an independent investigation so that we can learn all the details and make any corrections and hold people accountable if that's what is necessary here. So I think there's an awful lot of difference. Sorry, I just want to say one other thing, which is the diseases are also quite different. Legionnaires' disease does not transmit from one person to another directly the way that COVID-19 does. The Legionnaire's disease gets transmitted in the mist of steam, for example, in a steam shower, from the pipes, from the water that comes into a facility. And COVID-19, as you know, is insidious. You can carry it asymptomatically. You can convey it to other people asymptomatically for days, really, until you feel symptoms yourself. And so there's a lot of difference.
Brett Rowland at the Center Square, you directed agency leaders to identify cuts, but you have not announced the implementation of any cuts since the outset of the pandemic. Why is the state still spending as if COVID-19 hasn't affected revenue?
Well, I think I want to remind people that there are 2 different things affecting the budget, and I'll remind this to Brett as well. One is the highly unusual emergency that has occurred in the year 2020, and that's COVID-19. That's one aspect of the budget challenges, and every state is experiencing those. There is the other aspect, which I have been working on since I took office, and that is the long-term structural deficit that's been in place for decades now. And I came into office and identified it, I've held it up, and we've been addressing it really since day one. So we're continuing to look at the ways that we can cut government, the way we deliver services. I don't want to cut services. I want to cut the cost of government for people. So we brought efficiencies to state government. We're continuing to do that. We have proposals that we've talked about with some of the budgeteers and members of the legislature that are, changes in operations, not in programs, but in operations, and that's what we've gotten from all of our agencies. And we've begun to implement those changes, but those are not the bulk of what will need to happen in the budget. It's not, the changes that we make to operations are only a portion of what we need to, see as cuts to state budget in order to balance it. We also need to see stimulus from the federal government, which will help us to pay back the $2 billion of borrowing. That was really the purpose of the $2 billion of borrowing. So you may think that that hasn't already occurred, that we haven't already begun to make cuts, but actually we are doing it within the agencies even now. But there's more that needs to be done, and the legislature needs to weigh in as well.
Mike Militich at Quincy TV. Governor Holcomb just extended Indiana's public health emergency through the end of the year. Do you plan on extending our statewide emergency beyond December 12th with another surge expected? If the emergency continues, and I don't believe that the vaccines will have been distributed and that we will no longer have COVID-19 prevalent in the state of Illinois at the end of the current emergency. So I guess if I had to imagine whether we would have to declare another disaster for the state, I would say highly likely. Amy Jacobson. Governor, if you are encouraging Illinoisans to work from home, then why aren't you leading by example, which you did last week?
Thank you. Yes, I am encouraging people who work in offices to do everything they can to work from home. Not everybody who works in an office can work from home. In the job of governor, I do have things that I need to accomplish that require me to either be in the office or use the facilities of the government that I can't access at home. So I am trying to lead by example, and I did stay home last week when I could. There are days when I can't, and I'm trying very hard to make sure that the people who work for me are kept safe. So we've sent many people who work in the governor's office home. They're working from home, and if they can do that and still get their jobs done, that's what we've asked them to do. In my case, I must admit that some of it I can do from home, some of it I can't.
Shruti Bloomberg, the restrictions placed last month are intended to curb the surge and avoid a stay-at-home order. What's your sense of compliance or lack thereof? Has the state reached its limit for how much it can do with mitigations to curb the spread of COVID-19?
Well, as I have said before, we have not gone to a stay-at-home order, and that certainly would be the kind of the next step that we could take for mitigations. In terms of compliance, I think the vast majority of people in Illinois are complying. The problem is the people who don't comply have an outsized effect on people who are complying. So, someone who comes into a room with you, if you're wearing a mask, when they're not wearing a mask, well, that cuts in half the protection that you would otherwise get if you're wearing a mask. So those folks who aren't wearing masks are really putting others in danger. They're also, by the way, not protecting themselves. And masks are not 100% effective. They're about 80% effective, or something in that nature. And so, there are ways that you can catch the virus, not just person to person. If you're not wearing a mask, and if you're around other people who aren't wearing masks, boy, that is really a recipe for potential disaster. We need people to comply. We'd like to have 100% of people comply. There obviously are people who can't wear masks for a medical reason, but those are really a very small portion of the population. And so I'm hopeful that people will hear stories like the story that Shauna told, that they'll understand the tragedies that are happening around the state. And often they are happening in situations where people are not following the mitigations.
Chris Ty at CBS 2 is asking if the 109,000 doses we're expected to get include the 20 to 25,000 that Dr. already explained the city are getting today?
Those are separate. Is that included? Okay, I'm sorry. I know that they get a separate shipment, so forgive me for having that wrong. They get, the city of Chicago and major cities across the nation get a shipment directly to the city. And so the 109, as Dr. Ezike is reminding me, does include the 25,000 that would go to the city of Chicago. And again, if it's 25,000, it's really 12,500 people that would be getting it. And that's roughly proportionate. The city of Chicago has about 21% of the population of the state of Illinois.
Kate Chappell at NBC5 will be our last question. I know the governor has addressed this before, but we're hearing of even more suburban restaurants defying the indoor dining ban, including in Kane County. They say they must be open or be forced to close permanently due to the lost income. Should stricter penalties be in place to discourage owners from opening anyway? And if local health departments or police choose not to enforce the rules, do you think the state should get involved?
I just want to remind everybody that the laws of the state of Illinois get enforced by the local police departments, by local authorities, by, in this case, local health departments can also be engaged in this, local state's attorneys. That when laws get passed, executive orders get issued, especially in an emergency, we rely upon local law enforcement and local authorities, whether we're talking about speeding tickets or we're talking about health laws, or we're talking about laws that are designed to protect people from crime. If local law enforcement is not enforcing it, they're endangering the people who live in their jurisdictions. And so I would just remind people, we do rely upon local law enforcement for virtually all of the enforcement that occurs for all the laws that exist in the state of Illinois. Ignoring them is putting the people who live in your area in peril. And so I would urge law enforcement to listen to their public health departments, state's attorneys, to follow the law. We need everybody's help to make sure that we're keeping people safe. Bars and restaurants, I have pointed out to all of you, I even talked about it today, bars and restaurants unfortunately have suffered greatly because they happen to be places where there's an amplification of the spread of COVID-19. And it's not their fault. It is not their fault, but it is a fact. And so we've got to ask those people to follow the rules because they're spreading the virus when they open up and people come in and, you're mostly not wearing a mask when you're inside a restaurant or a bar eating or drinking. And that can be dangerous for everybody that's inside.
All right, thanks, everyone.
Thank you.
Hey, Jordan, I have a question for you. Look at your hand, Christina. So where is this